Hi there, we will get started and hopefully have some more people join us throughout the session. Thank you very much for coming along today. My name is Lucy and I lead the Compassionate Employers Programme at Hospice UK, and my job is to work with organisations across the UK to review policies, guidance and ensure they are equipped with the right support to prepare them to support employees through significant life moments. And when we talk about significant life moments, what we generally are working towards are organisations that are equipped to support people through terminal diagnosis, either of themselves or somebody that they care about, any caring responsibilities that employees may have alongside their work, as well as bereavement as well, and returning to work following the death of somebody that they care about. So today's session has been put on as part of our Compassionate Employers Programme. So you've been welcomed along today as your employer is a member of the Compassionate Employers Programme. And we are aiming to raise greater visibility during Carers Week on the impact of being a carer and what that means for those who are in caring roles, both professionally and personally in their lives. So we tend to record these sessions, just we know the nature of healthcare means that people can't always attend live. So thanks for those that are attending live, and the recording will be available for you to share with your network. So hopefully you'll find today's session really helpful, and you'll have some key takeaways from it that you can share with your networks as well. So during today's session, we will be discussing topics related to caring, but we'll also be touching on grief and bereavement as well. So if you'd like to interact, we would welcome you to via the chat box. And as I mentioned, the session will be recorded, but the chat box, anything that's shared within the chat will not be shared. So feel free to share anything if it comes up, if anything's personally that you'd like to share, or anything that is interesting from today's session. We always love to hear feedback. So some of the key learning outcomes from today is just to understand what is a carer, how caring responsibilities might impact us at work, some strategies on how we can support employees who have caring responsibilities, looking at the cost of caring and actually the real importance of self-care, and also some signposting to support and further resources that you can share as well. So due to the nature of this topic, just want to remind you that it's really important to look after yourselves. So if you feel triggered or upset by anything, as mentioned, the recording will be available. So if you woke up this morning and you thought, I really want to attend this session, but you're feeling a little bit fragile or anything triggers you, then don't worry, you can watch back in your own time. I'd also really strongly recommend that you take sort of 10 to 15 minutes at the end of the session, just to step away from your screens, get a drink, maybe have some reflection time. If it's nice where you are and not raining, then maybe get some time outside as well, just to kind of reflect on anything that may come up for you. We'll have some times at the end as well for discussion and any Q&A, so feel free to jot down anything that you might want to ask at the end of the session, and you'll also have the opportunity to email me directly with anything that you don't fancy sharing during the session. So just a little bit about the Compassionate Employers Programme. So we launched in 2019, and as I mentioned, we are here to try and make sure that all organisations are equipped to support through really significant life moments. And since our inception, we have been supporting a membership that covers about 165,000 employees. So we're really, really proud of that. We've got a growing membership year on year, and we'll continue to kind of champion the work that we're doing. Really, we envision a world where organisations feel better equipped to support people through those significant life moments, which means that we've built our programme around 3 key pillars. So that's greater visibility, greater education, and greater connection. And today is one of our series of webinars that we run throughout the year for our members to help with that greater visibility piece. We know that carers quite often go under the radar, maybe aren't identified within organisations. So this is one of the aims for this piece of work, is to try and make sure that organisations are looking out for those carers in their workplace and feel equipped to be able to support them effectively so that they can remain in work as much as possible. Just some of the key definitions that we'll be running through today. A carer is anyone who looks after a family member, a partner, or a friend because their illness or frailty, disability, mental health, or indeed addiction needs that additional support. So it's likely that we'll all have a caring role at some point in our lives. Many of us don't go through life completely without any dependents. So it may well be that we all experience this, and we quite often will experience this whilst we're also juggling our working responsibilities or other family commitments as well. Sandwich carer is a term which is becoming more and more prominent because we are seeing more and more in the workplace. So these are people who are juggling that responsibility of caring for both elderly parents or relatives whilst also supporting children or young dependents. We are seeing this primarily with the ageing population, but also people choosing to have children later on in life. So it's a really important one for us to be addressing as part of today's session. Anticipatory grief refers to the feelings of grief or loss that we may feel before a loss actually happens. So we see this a lot with people who are living either with a terminal or life-limiting condition themselves, or they are caring for, or they have somebody in their life that they are anticipating will die. Disenfranchised grief, often misunderstood and invalidated by social norms, but some examples might be mourning the life that we thought that we might have, loss of identity, loss of job, loss of situation. And we see this a lot with carers when they're having to give up their roles, their professional roles, to take on caring responsibilities. And in healthcare, we see it much more prominently where people are having to step away from their clinical roles to protect their well-being. And we have a huge sense of identity tied up with our professional roles, especially across the healthcare system. So just to set the scene a little bit, and understand why it's important for us to be talking about this. Every day in the UK, over 600 people leave full-time employment to care for a relative. 5.8 million people are unpaid carers across the UK, and about 3 million of those are also in employment. And we see 1.4 million sandwich carers at the moment in the UK. And as I said, we are expecting that number to grow year on year. Also really important to highlight that there are 400,000 NHS healthcare workers who have identified themselves as having caregiving responsibilities outside their day-to-day role as well. And the most recent State of Caring report by Carers UK found that 73% of carers in employment have said that they found it really stressful to juggle their work and their care, and 44% of whom have had to reduce their hours of work so that they can juggle that care as well. So we're seeing a huge amount of carers in the workplace, and the impact being that we are seeing people leave full-time employment or having to reduce their jobs significantly. In healthcare settings, we have to start to address this problem as we are seeing more and more people leave organisations each year. And of course, retention and recruitment within the NHS and across healthcare systems in the UK, more crucial than ever as we need that support. So just as I mentioned at the beginning, this week is Carers Week, so thanks so much for joining us. It's an annual campaign to help raise greater awareness and support for carers, and this year's theme is about caring about equality. And I thought it was a really good opportunity just to reflect on some of the inequalities that carers actually face. So some of those key challenges are the fact that there's a real disproportionate impact on women and marginalised groups. Again, another very prominent things for us to consider within healthcare, as we have so many women within the healthcare workforce. So women make up over 60% of carers in the UK, and the recent Carers UK research found that ethnic minority carers are more likely to be struggling financially, and also more likely to have concerns around services not meeting their needs in comparison to white British carers. It's also really important to recognise that caring comes with unpredictable and intense time demands. So caring responsibilities don't, nicely or neatly fit into our working schedules. They don't work with our 9 to 5 schedules. And actually, it's really important to be able to create the environment where people can be flexible to be reactive to the needs of the people that they're caring for. So on a good day, this might mean that their caring role can slot in around their working responsibilities. And on bad days, this might mean that it's all consuming. And we know that one of the key reasons why people leave full-time employment to work on, to focus on their caring roles is because employers really struggle with having that level of flexibility. And in healthcare, we have additional challenges around shift patterns and reduced workloads as well. So it's a really complicated area and something that is, continuing up for discussion about how we create more carer-friendly workplaces. We, of course, have to address the fact that carers are at higher risk of anxiety and depression and stress. It can be really exhausting holding down a job whilst you're also navigating a care role, and it can feel like you never really get to switch off. And we see that more and more with healthcare workers who are both in a professional caring role and in a personal caring role as well. So we're seeing increased levels of burnout, increased levels of compassion fatigue, and we'll talk a little bit more about that later on in this session. And of course, we have to highlight the financial consequences. So many carers have are forced to take on reduced hours, to turn down promotions, or leave jobs entirely, which can, of course, affect lifetime earnings and pension contributions as well. So it's not even just about the financial impact right now, but we're looking at the financial impact later down the line as well. So it's really important for us to be recognising that those financial obligations are there, and where we can as employers trying to support employees navigating, holding down their ability to have a role, a professional role alongside their caring roles. So I like to share this slide because I think it's really important. If you work in an organisation where you know that you've got carers, or if you lead teams, I think it's really important to be able to recognise somebody who might be a carer in your team. Carers notoriously do not identify themselves as carers, and actually reports show that it takes on average about 2 years to identify that you are a carer. I can see there is somebody on the call who has identified themselves as a carer, and I think, that's brilliant. That's the aim of today, is to try and make sure that people know exactly what it is to be a carer and can identify it both in themselves and in others as well. So until that penny drops, as an employer, what you might see is employees becoming overwhelmed and frantic as they try to keep all the plates spinning at once. Sometimes it can be really helpful if you are a line manager to directly address people, to support them at managing their workload, and sort of suggest that actually maybe you have got more of a caring responsibility than you've been able to recognise. And it can be that light bulb moment for them to realise how influential that caring role is, and actually start to self-identify as a carer, so that you can start putting those flexible and accommodations in place. Of course, we touched on the financial implications. So unfortunately, we know the health and social care system has many flaws, which means many families are carrying a really heavy load on their shoulders. And this can include paying for additional private care services or support. And of course, it also includes things like reducing hours at work or leaving altogether. And alongside the cost of living crisis, we are seeing more and more carers in real financial difficulty. We've also got sandwich carers who may well be looking at caring or paying for childcare, as well as paying for care of elderly relatives. So you can see the financial strain and where that is coming from. For carers who are working alongside their caregiving roles, quite often they just simply run out of hours in the week to focus on the rest of their life, which can really significantly impact their ability to have meaningful and strong relationships with their friends and their families, their partners and their colleagues. And it can also really impact their ability to have a healthy relationship with the person that they're caring for, as they shift away from being a mother or a daughter or a son to being a carer for that person. And it's really common to see carers living in real isolation because of this. When we're looking at carers, we're also thinking about that personal well-being and actually that overall exhaustion of caring. And it can take so much of our capacity. Often our physical and mental health really suffers under the pressure. So many people end up sacrificing their passions and their hobbies, and generally just not finding any time to be able to look after themselves, because they're pouring all of their energy into the care of that person. This can look different for everyone, but if you start to notice that your employees seem a bit withdrawn or frustrated or anxious, it might be the time to start having a conversation with them about how they are and how you can best support them to manage their life around that caring responsibility. And finally, I'm just going to touch on identity. It's not necessarily something that we talk about very often, but people with caring roles can have a really complicated relationship with their identity, both personally and in their professional lives as well. So somebody who was at work previously very confident and outgoing, driven and passionate might seem more withdrawn and reserved. And many of the people that we speak to really struggle because they used to be able to do so much. They loved their jobs, they loved taking on new projects, and they loved their careers. But actually, with this new caring responsibility, it can be really, really hard to take on any of those promotions or really throw yourself into something like your career, because that sheer level of brain fog and that lack of capacity that we have can be really complicated. And in healthcare, as I said previously, you know, our identity is so much tied up with the fact that we want to deliver amazing care for the people who come through our doors. We want to be able to be the best version of ourselves. And actually, quite often we're not able to do that because we have so much going on in our personal lives that really limit our ability to be able to show up fully at work. I'm going to touch on anticipatory grief quickly. So I mentioned at the beginning, anticipatory grief refers to the feelings of grief or loss that we might feel before a loss actually happens. And we see anticipatory grief a lot in people who are caring for relatives or loved ones. And I just wanted to highlight some of the things that you might see if somebody is living with anticipatory grief. Now, when I'm going through this, if you are a line manager or if you lead a team or indeed look after your colleagues, as a good co-worker, then, you know, be mindful of the fact that you might have people in your teams that are experiencing these things. And if you're in a healthcare setting, they may well be triggered more and more as the people are more likely to be exposed to other people who are going through a similar situation. So what might anticipatory grief look like? It may look like anxiety and worry. So, you know, how will this person die? How will my loved one die? What will the next few weeks or months look like? Will this be my last birthday or Christmas with them? And quite simply, some days it's, will it be a good day today or will it be a bad day? And it's that reactive that we need to be aware of with carers, that day-to-day changes can make a huge difference to how somebody is able to show up. You might see people have real increased irritability. You know, I don't have time for silly questions, silly jobs. I don't want to be involved in petty arguments. You know, I can't believe this person is complaining about something, the canteen being out of their favourite lunch, when I have so much going on in my life, and actually just feeling really increased irritability with the people around them, which can cause friction in the workplace. Some of us just have a real denial of reality, and we see this a lot in healthcare. It's a protection mechanism. We can't be triggered by everything that comes through the door, so we bury our heads in the sand. They're not really going to die. They'll be okay. They might get better. We can't face the reality of what's going to happen quite often because it's just too painful and too sad to think about, and so we bury our heads in the sand. Many people feel hopeless. They feel exhausted and hopeless with the reality that they just can't change the outcome. You know, we are a society of fixers, and in healthcare, we are definitely a society of fixers. We came into this profession because we wanted to make people better, and actually the reality that we're not going to be able to make this situation better can be really, really challenging for people to process. Many people also feel really let down by the system, where the social services aren't in place or the financial support isn't in place. And so many people just feel really alone in this challenge. It's also important to recognise that many people who are living with anticipatory grief will mourn the changes of the person who is ill long before they die. So this might be it's not exclusive to, but we see it commonly with cancer diagnosis, dementia, and Alzheimer's. These are often discussed as things such as living losses. So these aren't necessarily known terribly well, but the person that they were before isn't the person that you're caring for now, and you slowly lose them. And that can be really, really hard as you mourn that person, whether it's their physical appearance, whether it's the mental side of things and their personality. It's also really important to highlight that some people may well question their belief and faith, or also heavily lean into their belief and faith. So some people may turn to their faith and think, why would somebody do this to me? Why would somebody make my loved one suffer like this? Or on the flip side, you might see employees really leaning into their faith because their community has rallied around them and they are going through the motions of coming to terms with with the reality that the person is going to die, and preparing for that reality. I'm going to touch on disenfranchised grief. As I mentioned at the beginning, it's something that many carers experience in varying levels throughout the time that they're caring, because caring impacts every part of our life. So disenfranchised grief might look like guilt. So at work, this might look like, I'm not able to function or perform the way that I was before. I can't deliver the care to this patient that I would normally be able to deliver. I'm letting my team down. I'm letting my managers down. And then in our caring roles, we may well feel really guilty because we might well resent the person that we're caring for and resent this situation. And resent the idea that we don't know how long we might be in this position for. As I mentioned, so many of us experience loss of identity. So who am I now that I'm a carer? I'm not the same person. I'm not the same nurse. I'm not the same healthcare professional or colleague or partner anymore. And really importantly, when we're looking and speaking to people who have caring responsibilities, who may well be looking after somebody with a life-limiting or terminal condition, we know that at some point we're probably going to support that person through a bereavement. So this loss of identity also impacts us then. If you've been a carer for a long time for somebody, after that person dies, it can be really difficult to figure out who you are again, because you suddenly have all of this space that you didn't have for these previous months or years whilst you've been a carer. So who am I now? Who am I now that I'm no longer a carer? I had to completely reform my life to be a carer, and now I have to completely reform my life to be someone without the person that I've been caring for all this time. Lots of people feel real anger and grief for the life that they wish that they had. So, I was meant to be moving up to a band 6 nurse now, or I was meant to be continuing on a professional development, or I was meant to travel, or I was meant to move to a different city, and now I can't because I have to stay home and I have to care for this person. I have to stay close. I never know how long I've got. I never know when they might get worse. So many of us mourn that life that we thought that we had, that kind of carefree life that we had before this person became sick, or before we had that caring role. And of course, we have to recognize that many people will have a real loss of drive and motivation. When you know as a carer that there isn't necessarily a timeline that you're working to, many people find, what's the point? This is never ending. I don't know how long I can keep going with this. And again, these are really, really common themes that we see in people who have that professional role of caring and personal role of caring. And one of the key things that we need to be able to spot during this is that sign of burnout in our colleagues and in ourselves, and when it's starting to impact our relationships with our colleagues and with our patients whilst we're delivering care as well. So I'm not sure if anybody's heard of the pink flamingo theme, or theory, sorry, but it's often used to support postpartum mothers. But I personally think it rings true for carers too. So the idea is that flamingos experience a process of physical and emotional transformation during the period when they're raising their young chicks. So they're drained of all of their energy and their nutrients as they pour everything into their young, which causes them to turn from their very vibrant pink into a very dull pink, or sometimes completely white. So their pink completely disappears. And I think it's a really nice analogy to know that actually as a carer, sometimes we feel like we've lost our pink too. We're relentlessly pouring all of our emotional and physical energy into our loved ones, making sure they're okay, making sure we put them first, and protecting all of the other people around that. And for a while, this can feel really relentless, that we might never get our pink back. But I think it's really important to recognise that as time goes on, as we get slightly more capacity, as we support each other, as we create these carer-friendly organisations and learn how to protect ourselves, we can slowly get that pink returning. I really like this analogy. I found it really personally effective as something as a carer. So I don't like to lean too heavily into grief models, but I do think this one is particularly helpful, especially for employers who are managing and supporting employees who are either navigating caring responsibilities or returning to work following bereavement. So this model helps to highlight how we bounce back and forth between loss and restoration. So during our loss days, we might lean really heavily into our grief. We might sit in the sadness and focus on our lives before our loved ones got sick, or in fact they died. And I often refer to these days as like duvet days. So they're the days that we feel really weighted down by our grief. We can barely peel ourselves off the bed or sofa, or we're going to work and we're just kind of moving through the motions. We're barely there. We're kind of a shell of a person. And during our restoration days, we may lean a little bit more into accepting the reality that we're living in, making memories with our loved one that we're caring for, or accepting our new identity as a carer too. And I think this model is particularly helpful for managers and colleagues who are supporting employees, because it helps to show that it's not linear, that it's not necessarily a straight path, and it can ebb and flow between that kind of loss and restoration. And it's very important to recognise that employees might seem fine one day and then they may well be struggling the next. So in the loss coping stage, an employee might find it really hard to concentrate on tasks, or seem not interested in personal stories with patients. They might seem withdrawn during team meetings, or withdrawn from the team whilst you're working on a ward, for example. And then the same employee a few days later may come in, seem really focused, seem really engaged, and engaging with patients, engaging with families, and really leaning into their work. But what's really important to recognise is that it's not linear, and we need to be prepared to be able to support employees as they maybe bounce back and forth between this loss and restoration, sometimes for months and sometimes for years. And as carers, one of the hardest things is that we never really know how long we've got left. But also so many of us have to take each day as it comes. So whether it's a good day or a bad day will completely dictate where we can sit in terms of that loss or that restoration. We quite often make the mistake in the workplace of seeing people in that restoration phase and think, well, they're coping well, so they'll be absolutely fine. But actually, it's really important, especially for carers, that we continue to have this really open dialogue, this space for vulnerability where people can bring their full selves to work, and we can support them in the workplace, providing that compassionate space for flexibility and understanding, so that they can continue to lean into their work as much as possible in those restoration phases, and also honour the loss that they're feeling as well. So I just wanted to highlight for line managers and employers who have carers in their teams, it can be quite hard to recognise carers and identify them. But it's really important for us all to be working towards creating carer-friendly teams. So some of the tips on this are: educate yourself. So be aware of the support and resources that are available for carers within the organisation, whether that's flexible working policies or employee assistance programs. But also, lean into learning. It's great to have people here on the call. It will be great if you can share it with your networks as well. Being able to lean into awareness campaigns like Carers Week or Grief Awareness Week will help you to learn more about how you can adapt to support the people within your organisation. But also learn from your experiences. It's okay if you don't get it right 100% of the time. Each of these situations will be incredibly unique for each of the employees. So it's really important to use that lived experience so that we can keep learning and make it better for the next people who come along. Really important to use inclusive language, ensure that language used in any communication is inclusive and also acknowledges the diverse needs of carers. So remember that each person's situation is entirely unique, so do your best to honour their experiences and use any resource or guidance that may be available to help you make reasonable adjustments for their needs as well. I'll share a link at the end, but as a member of Compassionate Employers, you all have access to our members hub, and within that hub we have an entire section on cultural support, supporting different cultures and different faiths, and within that there is lots around supporting different cultures and faiths and recognising their role in terms of caring for loved ones, rituals around end of life, as well as bereavement. So that can be really, really helpful to make sure that you are being really mindful of all of your different workforce and all of the different cultures and faiths that might exist within them, and being able to be as inclusive as possible and adapt your policies and language to make sure that that's appropriate for them. Really important to lead with compassionate communication, so create safe and supportive environments for these conversations, encourage carers to discuss their needs and any adjustments that they might require. It's really hard sometimes to get people to open up, and I think building those really trusting relationships from day one of employment is really, really, really powerful. We have just created a get to know me document, which again I will share, and that is something that you can work through with your colleagues and your teams, or personally, that you can share with your manager, which can outline any caring responsibilities, significant dates, all of the kind of key things that can mean that that kind of compassion can be there from day one. Really important to have regular check-ins. Not always great at doing this within the healthcare settings. We are busy people, and it's very, very hard sometimes to have that kind of continued communication with our teams, especially if we're working on different shift patterns, or if we've got people who maybe work reduced hours. But try wherever you can to schedule regular one-to-one meetings with your team members who are carers to just understand their needs of support. So take their lead on what support is helpful. This might mean that, you know, you support them with their workload, or you put flexible arrangements in place, or maybe it's as simple as just making sure that you've got that protected one-to-one time every month or every week to try and discuss their needs and the changes to their caring responsibilities, so that we can continue to create that space where they can bring their full selves to work. Where you can, promote flexibility. Again, not always as easy in healthcare, but actively promoting and facilitating any flexible working arrangements that can be put into place, if that's working shorter shifts, if it's working night shifts, if it's working on weekends. We know that, you know, flexibility is one of the key things to keep carers at work. So even if we can do that to a reduced schedule, we know the real significant impact that this can have on somebody's well-being and their sense of identity. Recognising and appreciating and including, so acknowledging the contributions of carers and showing appreciation for the efforts and the work that they're putting in. Often carers get forgotten about and left out at work. Sometimes that's out of social things like drinks or, you know, staff lunches, but also it can be things like team meetings being held on their non-working day. So try your best to really be mindful of that and adapt to their needs to make sure that they are included and feel as much part of the team as possible. And the last one is leading with compassion and trying to spot the signs of struggle. We know that in healthcare we see a huge level of burnout and compassion fatigue, and that is to be expected with the rising pressure on healthcare workers, and those who have personal caring responsibilities are at much higher risk of that burnout too. So leading with that compassion and building that strong and trusting relationships with each of your employees will really help you spot the signs that they might be struggling early on, and try to help you to implement those adaptations for support in advance of them turning into burnout and compassion fatigue. So I just wanted to highlight this. If you are balancing your caring responsibilities alongside your employment, it's really important for you to know your rights. And there are some legal protections that are in place that came into place just last year to support carers. So the Carers Leave Act came into force last April, and the Act means that employees are entitled to up to 1 week unpaid leave each year to arrange or provide care for a dependent who needs long-term care. So every employee who has a caring responsibility is entitled to have that 1 week unpaid leave. Since the 6th of April as well, you've been able to request the right for flexible working, which means that you can request different flexible working arrangements to help you find a working pattern that can help you keep you in work whilst also navigating your caring role too. So your employer doesn't have to say yes, but they do need to have a sound business reason for saying no. And some examples of that flexible working might be working compressed hours, job shares, changing working days or hours, remote or hybrid working, changing shift patterns, things like that. Having set days of work, those sorts of things you can request within your flexible working. And really importantly, and one that I don't think that many people know about, is the time off in an emergency. So you have the right to time off in emergency. You are protected under employment law to have time off to look after somebody who is dependent on you. So the law doesn't actually state how much time you can have off or on how many occasions, but employers do have to protect you if you need to have time off. For example, if there has been a significant event happen in your life, an accident happen, or if the person that you care for has been suddenly taken ill, it's really important to know that you've got that time off if you need it in case of an emergency. So we have had a little conversation around kind of building those carer-friendly teams, and I just thought it would be really helpful to add in some questions in terms of how you might want to facilitate these conversations. It'll be interesting. I know we've got a couple of carers on the call, so any additional questions that you would like your manager to ask you or you would like to share, then I'd be really intrigued to hear your reflections. But everyone's situation is different. So it's really important to ask, what does your caring role look like day to day? So some people might be providing personal care, and some people might just need to be at home at certain times to provide support with meals or medication or letting carers in. It's really important to understand what kind of level of caring somebody has so that you can adapt their working day and working life. How might your caring responsibilities change in the future? Now, this can actually be a really thoughtful and supportive way to ask somebody or speak to somebody about somebody who maybe has been diagnosed with a terminal or life-limiting illness. We often make the mistake of saying things like, do you know how long they've got left? And that can be incredibly hurtful for somebody who's a carer. Like, one, because the likelihood is no, we don't know how long they've got left. Nobody can tell you that. And two, it's just a very insensitive way to kind of approach that topic. So how might your caring responsibilities change in the future is a really nice kind of open way of being able to let that person lead that conversation on how things might change for them. Do you have a support network outside of work? So not everyone does. We often make the mistake of thinking that everybody's got loads of family and friends rallying around them, but many carers are working independently. Maybe that's because they're the most caring sibling or has the least on in their lives, but quite often caring responsibilities fall onto one person. So asking this question is the perfect time for you to help them with any signposting. There's some really brilliant resources out there, and I've linked some of them at the end, so we'll make sure that we share those. Asking the question, would flexible working or changes to your workload help? So, don't try and pressure them into reducing their hours, but make sure that the option is there. Make sure that you're familiar with your organisation's policies and guidance, as well as the legal protections that we've just discussed too, so that you can make those adaptable changes as much as possible to fit the needs of that person. If you're struggling, how would I know? Many of us don't necessarily know how to answer that question, but it's really important to ask it. Many carers will face burnout, so try to use questions to encourage them to think about how they might be responding to things. They might be isolating themselves. Are they overworking? Are they not showing up? Are they struggling with their workload? Are they falling behind on priorities? And think about how we can support them and identify those ways that they're struggling. And lastly, how would you like me to support you during these times? So this is a really great way to support, building that trust, creating space for that vulnerability. In healthcare, we're not always the best at being vulnerable. We kind of have a very stoic keep strong and try not to let anything impact us too much. And one of the things that we're trying to do is really create that space for acceptance and vulnerability, and know that actually it's really a powerful tool to be able to be vulnerable, and it will make us the best versions of ourselves to be able to deliver the best patient care possible, and also support teams be really thriving and flourishing as they work together. So really important to create those spaces as well. Thanks, Alex, for that comment. Just like generally checking in, asking how you're feeling, checking in on updates. Absolutely. I think, one of the key things that we forget is that, especially in healthcare settings where we're maybe not seeing each other all the time, or we're working on different shift patterns, how do we keep each other in the loop? What's changing? Making time for those check-ins are really, really important. So we're just going to have a little kind of overview of burnout and compassion fatigue. So burnout is a state of physical and emotional exhaustion, and it can occur when you experience long-term stress in your job, or when you've worked in a physically or emotionally draining job for a long time. And compassion fatigue is a very specific form of burnout, which is characterized by emotional and physical exhaustion, which can diminish our ability to empathize and feel compassion for others. So it's really important to highlight that employees who have both personal and professional caring roles are a much higher risk of burnout and compassion fatigue, which can, of course, impact our ability to deliver patient care. Not because they don't care, but because one of the key determinants of burnout is detaching from our emotions. And sometimes that is our protection mechanism when we're looking after people. So how do we recognise care as burnout? So we know that the pandemic, the cost of living crisis, has put a huge strain on health and social care systems. We know that our healthcare workers are under more pressure now than they've ever been before, and they are receiving less and less support. The same goes for people who have personal caring responsibilities, where those services used to exist and now aren't there as much, and so it can make it much, much harder to have that support, which means that carers are burnt out. So 73% of carers have reported being burnt out, and 35% of carers say whatever break they do get from their caring roles, they're actually doing paid work. And I would imagine that that number is even higher in healthcare. So how do we recognise the signs of burnout in our carers and in the people that we work with? So emotional and physical exhaustion, withdrawal from friends and family and colleagues, loss of interest in activities that we maybe previously enjoyed, feeling generally hopeless or helpless, changes in appetite, both losing weight or gaining weight, changes in sleep patterns and sleep disturbances. Important to highlight that many people who are carers have got caring roles that go through the night. They may well have to check in on people throughout the night or administer medication through the night, and then have to go and work a full day after that. Many people really struggling with the ability to concentrate, having this incredible brain fog, people being so run down that they just get sick more often. Their immune system just simply has not got the time to build itself up and look after itself. And many people feeling real irritability, frustration and anger towards others, whether that's generally at the world, whether it's at their colleagues, whether it's at patients, whether it's at the person that they care about or their families or friends. It can be a really, really complicated time. So one of the key things is being able to identify and see these things in your team. So if you see somebody within your team who has a caring role and you're noticing any of these signs, it's time to have a conversation with them and try and create some space to listen to their experiences and do what you can to try and put support in place to support them with each of these areas. So we all have the responsibility to look after ourselves and to look after each other. And the reality is that prevention of burnout is much more effective than the treatment of burnout itself. Communication is key. So if you're a carer, try to communicate with your support network, whether that's friends, families, employers, social workers. Lean on the community around you. If you're managing a carer, then don't be afraid to lean into that conversation. carers are notoriously bad at advocating for themselves and their own needs because they're so used to putting everybody before them. So try and be their advocate, set regular check-ins, hold that space of vulnerability and create that environment built on trust and honesty. Try to set realistic goals. Try not to carry the weight of the world on your shoulders. That's easier said than done quite often, as so many carers are carrying such a heavy load. But the responsibility of care quite often falls on one person. As I mentioned, it might be the most caring sibling or the one who has less on. So often carers will carry that weight really independently, and that can be really tricky. But try to remember that to give the best care possible to the people that you love and to try and avoid that burnout, you also need your cup filling too. So ask for help. See what can be offered through your employer, through local community groups, through family, through friends, through respite. Try and build a network of support who can carry you on this really difficult road as a carer, because these people are also going to be your support network when that care role comes to an end. Do your best to be informed. So if you want to be the best carer you can, then seek information from experts, learn about the ways to look after yourself, learn about the ways to look after the person that you care for, lean on professionals, charities and community groups to help you manage those day-to-day activities and get some respite. Prioritize personal health and well-being. Also really tricky to do, particularly hard for most of us, because who has the time when you're trying to juggle all of these different things at once? So much is overflowing for us, our emotional, our physical, our cognitive ambitions. So where can we find the time for self-care? But this is where your support network can be really important. So even just being able to have somebody come and be with the person whilst you go for a walk or eat a home cooked meal or read a chapter of a book or listen to a podcast. You know, self-care doesn't have to be these huge acts. Those little actions can make a huge impact in terms of getting us through, but also preventing that burnout that we've spoken about. And this last one is arguably the most important, and it's to make space and honour all of the feelings that might come up for you. So caring is a lot and it takes a huge toll on our lives, and it's okay if you don't love being a carer, if you secretly wish that it would be over. Many of us feel very guilty for those sorts of feelings, but when it's so all-encompassing and our life has had to be completely put on hold, it's very common to have that feeling of just wishing it wasn't your problem to have. So try to honour all of the emotions as they come up, give them space and time. Sadly, you can't outrun them, and bottling them up can lead to, higher risk of burnout and illness. And it's really important to kind of make memories with the person that you care for. If you know that they're living with a life-limiting or terminal condition, and you know that you don't have a huge amount of time left with them, try to make the time to make those memories. On the good days, try and make memories, whether it's documenting photos, videos, voice calls. If you live further away and you're speaking to them on the phone, record telephone calls so that you can listen back and hear their voice. If they're not somebody who wants to be filmed, there are little ways for you to be able to kind of make really special memories with those people that you're caring for. So lastly, just before I go on to some signposting, I just wanted to put this up here because I think sometimes self-care we think about as such a massive thing, and I think breaking them down into these 3 categories is really helpful. So something that helps you relax, something that energizes you, and something that makes you happy. And I find that this is the most helpful way for me to make sure that I am prioritizing something for myself every day or every week. So for me, the things that help me relax, being outside, walking, cooking, listening to music, listening to podcasts, things that energize me might be going to the gym, going for a dog walk, going for a run. And the things that make me happy, simply spending time with my family and my friends, especially with my husband or my baby. It's so important for me to have that protected time to do each of these things. So if you take one thing away from today, try to use this tool as something as a reminder. If you're like me, have little notes all over. I've got post-it notes of the different things just to remind me, so that I've got that visualization of it as well. So lastly, I'm just going to signpost you to some of the resources. So as I mentioned, you are all members of the Compassionate Employers Programme, and so there is a huge huge resource online for you to be able to access. I'll make sure that you've all got a link to it after this. And within there, not only do you have the tools for navigating terminal diagnosis, caring responsibilities, and bereavement, but it also breaks it down for whether you're an employee who's navigating it, whether you're a line manager who's navigating it, whether you're a HR person who's trying to navigate it and create policies and guidance for the wider organisation. So there's huge amount of resource on there. I've highlighted our carers portal. This is part of the carers portal, but it's got a huge amount of information on there and resource. We've also got things like planning for the future and how to have conversations with your loved ones that you're caring for, how to have those conversations about end of life, how to prepare for those moments, as well as following bereavement, how to navigate those early days of grief, all of the kind of what to do initially and how to support yourself returning to work. That is a whole other session that we will do later on this year around returning to work following a bereavement. That can be really tough when we are navigating working in healthcare and living with a bereavement as well. And just to highlight some of the other support networks that are out there. So on our Hospice UK website, we have all of the steps around kind of understanding what it means when you have a terminal diagnosis and understanding what to expect in those final days of somebody's life. That can be really helpful if you're kind of anxious about the future. Carers UK is a wonderful charity who have a helpline. They've got lots of signposting for support as well, and a huge amount of research on their site as well. Age UK can be really helpful to just help you find financial support, anything dementia specific, as well as respite signposting as well. Alzheimer's Society has got a huge community forum. So if you want to connect with other people who have shared experience of caring for somebody with Alzheimer's or dementia, would really highly recommend that. I know lots of people have used that to find their support networks, to make really crucial friends to carry them through those caring roles. And lastly, Marie Curie, who also have a helpline, lots and lots of signposting and support, lots of information about anticipatory grief as well. So some things to kind of keep you prepared. I'm going to leave it here to answer any questions or any reflections that anybody has from today's session. The carer's passport. Yes, sorry, I skipped over talking about that. So a carer's passport, the link will be within there as well. So it's a document that was created a few years ago, and it is literally a template for you to go through with your manager to highlight your caring responsibility. And it's a document that you can take with you through whichever, through your career. So whether you're moving jobs or whether you are, moving employers, the idea is that you can give them this document that you don't have to keep repeating yourself, so that you can keep it updated with your caring roles and responsibilities. It's just essentially somewhere to document that role. So I'll make sure that you've got a link for that. The session link for this should be able to come, it will be in the next couple of days, so hopefully. And I think what we're probably going to do is the next webinar will be in September, and we are going to be doing a session around suicide prevention and mental health in the workplace and healthcare workers, mental health and suicide prevention. And then in December, as part of National Grief Awareness Week, we'll probably do a bit more of a session around returning to work following a bereavement. Should also just raise awareness that we do have a coping with professional grief session that we run quarterly as well. And that is a session which is directly for healthcare workers who work in settings where they are constantly exposed to end of life and dying and grief. So it's a good opportunity for people to come along and learn some of those more practical skills. Matt, anticipated grief. Yeah, so I would recommend, oh sorry, I think I've probably covered that in my last bit, but the question around Alzheimer's, definitely I would go onto Alzheimer's Society and have a look at their resources on there, but also Marie Curie and Carers site have also got some really comprehensive things, and we have got some toolkits actually on the Hospice UK site for supporting people with dementia as well. So perfect. All of these webinars are recorded and shared, so we will make sure that we can get them out to you. Of course, that's fine. Yes, Alex will make sure that our contact at Anchor has got all of the details for each of the webinars, and I'll email you separately with some of the exact dates so that you can put them in the diary. Perfect. Thank you very much, everyone. If that is all for today, then thank you so much for coming along. If there's any questions that you would like to send me directly, then you're welcome to email me directly. If not, then thank you very much and have a lovely day.